Heart disease is the cause of 1 in 3 deaths for women in the U.S., and it's hard to believe that it is still that high. Well, today, Dr. Charles Lambert from AdventHealth is here to explain what causes a heart attack, but I think most importantly, of course, how we can prevent one. Welcome to the show, Doc. How are you today?
Very well, thank you.
So we were talking about last week, it was Wear Red. Everyone's starting to raise awareness, of course, in heart attacks. And I'm one of those people that I feel like, you hear heart attack, you think you know about it, you think you know what to do, but it's always good to have a little bit of a refresher. So let's first start. What exactly is a heart attack?
So a heart attack is, and it can be from a bunch of different causes, but it's basically when a piece of your heart dies, some of the muscle dies. And
so moving symptoms then, I would think, is one of those things that people need to know about at least. And I've heard sometimes a mix-up of symptoms, like, oh, ignore this, but pay attention to this. Shed some light, if you will.
So the big symptom talks these days are the differences between men and women.
Yeah.
So men, typically elephant on your chest. You see it in the movies all the time. Diaphoresis, sweating, shortness of breath. Women have, and we're wearing red for women last week, different symptoms. It can be a toothache, it can be a neck ache, it can be a little bit of an upset stomach. Very atypical symptoms, and a lot of times women just go about their merry way and don't think anything about it.
Did you say a toothache?
Can have a toothache. Some people will have a little bit of pain in their jaw and they think it's a toothache. That can be a premonitory symptom of a heart attack.
Why? Why is that? Why does pain kind of go up that way?
Well, without getting into it in too much detail, the nerve referral patterns, the parasympathetic nerves and the nerves that relay pain can be in your jaw, in your neck, as well as, sounds like it's in your heart. So there are different pain referral pathways. That happens to be one of them.
And I think it's interesting that men and women do have different symptoms. Have we found out why that is, why there are different symptoms between the two?
There are a lot of reasons, definitely we're different, right? But biologically and physiologically, a lot of different reasons, and even the causes for heart attacks can be different in men and women. A lot of women have heart attacks without these tight narrowings in their arteries. A lot of research is going on just to ferret out what we should do with those ladies. But there are different mechanisms in men and women.
Well, why is it in women then? If it's not the narrowing that you just spoke of, what are some of the leading reasons or leading causes?
There's a whole list of possible physiologic reasons. A lot of it has to do with the different vasomotor responses, the way your blood vessels respond in men and women.
Okay.
Part of that's hormonally modulated. Some of it is you can be at higher risk of a heart attack if you're a woman based upon your gestational history, how many kids you've had.
Really?
Yeah, there's a huge literature, scientific literature on this, growing every day. We've got a lot of local research projects related to the differences in men and women in heart disease.
As a mother myself, I feel like sometimes when you feel a symptom, I always talk myself out of it. Like, oh, I'm really not feeling this or thinking this, especially since the systems are so vast for women. What do people need to keep in mind when it comes to treating one? If they think like, okay, this is something I need to do. I think this is interesting, and again, we can't say enough.
Well, one of the biggest problems is getting people to realize that their symptoms may be serious.
Yeah.
The classic thing was the Elizabeth Banks little short film that the Heart Association produced a few years back. She's making, breakfast for her kids, feels a little weak and dizzy, gets a little pain in her jaw, says it's nothing, eventually collapses on the table while she's getting her kids off to school. That's very typical for, denial is not a river in Egypt, as we say.
Yeah.
Men typically deny, but women do as well. That's number one. If you think you're having a heart attack, there's no harm in going to see a physician or an urgent care or an emergency room.
And you even say call 911 too is key. Don't try to drive yourself, right?
Absolutely.
Again, this is one of those things that I'm so glad you're able to talk about, that we're able just to kind of remind people how serious it is. And of course, for more information on heart disease, just visit the website you see right there on your screen. And thanks again, Doctor, for your time.
Pleasure.